Hi, everyone. Welcome to our lecture series on generalized anxiety disorder, or GAD. Today, we're going to discuss generalized anxiety disorder, and we're going to go over how we would go about treating it in a clinical setting. So in terms of the outline, I'm just going to briefly discuss who I am. I'm then going to describe generalized anxiety disorder. We're going to go over prevalence. We're going to look at symptoms, and we're also going to examine the cognitive models of the disorder. And then we'll finish by examining the steps that we generally take in a cognitive behavioral style treatment approach. So hi, everyone. My name is Emily, and I'm a PhD candidate in counseling psychology at McGill University. I did my bachelor's and my master's in psychology also at McGill. I'm an intern here at the Emotional Health CBT clinic, and I have treated and am currently treating clients with generalized anxiety. So I'm quite familiar with the disorder and the steps required in treatment. So what is generalized anxiety disorder? Well, first and foremost, generalized anxiety disorder is a disorder of chronic, excessive, and uncontrollable worry. Individuals with GAD will worry about the same types of things that we all worry about in our lives, right? This can include our family, work, school, finances, health, relationships, and even like more minor things like punctuality or the ability to make decisions. The main difference is that these worries are nearly always present in people with GAD, kind of like background music constantly playing in someone's mind. And not only do individuals with generalized anxiety find themselves worrying more often than not, they also worry to an extent that is inappropriate to a given situation, worry when nothing seems to be wrong, and also worry about hypothetical or imaginary situations. And because these worries are uncontrollable, it generally causes a lot of distress in people. So generalized anxiety is often accompanied by a host of other symptoms, including sleep problems or fatigue. Individuals with GAD often report a really hard time falling asleep or even staying asleep just because they're constantly worrying in their mind. And because it's physically and cognitively exhausting to constantly worry, it's not unusual for people with generalized anxiety to also report fatigue. We also see difficulties with concentration. Because worries take up so much cognitive space in individuals with generalized anxiety, it's not unusual for these individuals to kind of hyper-focus on their worries to the detriment of their concentration or of other tasks. We also see restlessness or feelings of being kind of like keyed up or on edge. And that's because constant worrying leads to a state of anxiety, and that triggers our fight or flight response as well as our sympathetic nervous system. We see irritability. And again, this is just a byproduct of being anxious and worried nearly all the time. And we also see muscle tension, especially in the jaw and in the neck, since these are the muscles that we tend to flex, perhaps unknowingly, when we're feeling anxious. So generalized anxiety disorder is the most common of all anxiety disorders. It's estimated that about 8.7% of Canadians will experience generalized anxiety at some point in their life. And that is quite a substantial number, right? That translates to approximately 3.3 million Canadians who will be personally affected by generalized anxiety throughout their lifetime. So since generalized anxiety disorder can be conceptualized as this disorder of constant worrying, it's also helpful to describe worries. Generally speaking, the action of worrying includes two important components. The first is thinking about negative situations that can happen, as well as their potential outcomes or consequences. The second involves problem solving and other mental attempts to deal with those anticipated outcomes or consequences. Additionally, worries are typically triggered by three types of situations, and these include unpredictable situations where the outcome is unclear, novel situations where one experiences something new for the first time, and ambiguous situations where the situation or the event is not very well defined and the outcome is also unknown. Now, the action of worrying, although it's a very important theme in generalized anxiety disorder, it's also completely normal, right, for all of us to worry during our everyday lives. In fact, worrying can even be adaptive at sometimes, right? Because it helps us anticipate and prepare for certain situations or outcomes or consequences. So it's really helpful to think of worries as existing on this continuum, right? Ranging from little to no worries present to severe and disabling worries. And it's only when these worries become present on a near daily basis, are excessive, are uncontrollable, and begin interfering with someone's daily functioning or leads to significant distress, do we then consider a diagnosis of generalized anxiety. Worries also relate to other important cognitive components of generalized anxiety, all of which we will examine individually. But these include the positive beliefs about worries and their functions, intolerance of uncertain or ambiguous situations, as well as cognitive avoidance. Individuals with GAD tend to see worrying as something that is useful, positive, and adaptive. So this means that it's really difficult for these individuals to stop worrying because their worries are really perceived as holding an important and positive function in their lives. There are generally 5 types of beliefs that individuals with generalized anxiety hold about worry. The first views worrying as a positive personality trait that indicates that, someone is good, someone is moral, and someone is responsible. So for example, someone may be worrying about their job performance, and they may think that that indicates that they're, conscientious and hardworking. The second views worrying as helping guide the problem-solving process by anticipating, planning, or even preparing for various situations. So for example, someone, may worry about an upcoming vacation, and that's going to help them kind of prepare and plan in the event that problems arise on a trip. The third views worrying as kind of like increasing one's motivation and ability to get things done. Since when we worry about something, it typically also indicates that, the thing we're worrying about is something that's important to us. So for example, and this is one that we see very often, students tend to worry about their upcoming exams because they're concerned with their performance, right? And that may help them to motivate themselves and to study harder. The fourth views worrying as protective against negative thoughts and emotions, because worrying about a hypothetical situation can help emotionally prepare someone in the event that that situation actually occurs. So for example, one may believe that worrying about the risk of a potential breakup with a partner will help them cope with feelings of sadness, of anger, and of disappointment that they would experience should they actually experience that relational break. And lastly, this is kind of like the more superstitious belief that we see in generalized anxiety, is this idea that worrying can prevent negative outcomes and other bad things from happening. So basically, the action of worrying in and of itself can then decrease the likelihood of something bad happening. So for example, someone may notice that every time they're about to go on an airplane and that they worry about the flight beforehand, the flight ends up going very smoothly and ends up being very calm. So then they may start believing that, hey, if I don't worry about the flight beforehand, something bad is going to happen in the flight, because every time that I've worried about a flight, things have ended up going very smoothly. So these 5 types of beliefs kind of help decrease anxiety in the short term because it helps provide a sense of control in situations that are otherwise construed as ambiguous and kind of unpredictable. However, they also increase anxiety in the long term by reinforcing the notion of worry as a good thing. So the frequency and the severity of worries may continue to increase, hence contributing to increased overall anxiety. So as we've discussed previously, worrying can be triggered by situation and events that are unpredictable, novel, or ambiguous. All of these situations and events have one thing in common, and that's that their outcomes are uncertain and they can't be predicted with 100% certainty. Individuals with generalized anxiety tend to hold a set of negative beliefs about that uncertainty and its implications in their everyday lives. They find uncertainty very distressing, very stressful, and very upsetting. And therefore, they kind of believe that it needs to be avoided since it will lead to more unexpected and more negative events. So it's kind of fair to characterize it as this very intense intolerance for uncertainty. And in the absence of that certainty, individuals with generalized anxiety tend to make threatening interpretations of ambiguous information, and they'll always conclude that a negative outcome will ensue. They tend to also perform poorly in those ambiguous situations and have really low self-confidence in their abilities to deal with those ambiguous situations. And to conceptualize the extent of this intolerance, it's kind of useful to view it as an allergy. So for example, let's say that one is allergic to pollen, right? Even a very small exposure to pollen can lead to a very strong physiological reaction. The same is true for individuals with generalized anxiety when it comes to facing uncertainty in their lives. Even a very small amount of uncertainty can lead to very strong feelings of anxiety and accompanying worry. So for example, let's say that you get invited to a dance class by friends and you've never been to a dance class with friends before. So this is a novel situation with an uncertain outcome. You may start finding yourself thinking some what if statements like, what if I can't follow the steps of the dance? Or what if I'm forced by the instructor to participate when I don't feel like participating or I'm not comfortable in participating? This leads to the development of worries, right? So for example, I might look foolish. And if I look foolish, my friends may never invite me out in public again. Or if I look foolish, the instructor may mock or like publicly laugh at me. And that can then feed back into more what if statements, which then leads to even more worries. And that eventually leads to a state of high anxiety. Now, all of us can get caught up in these worry cycles from time to time, right? These are relatively normal. But the difference in individuals with generalized anxiety is that a cycle similar to this example may happen multiple times per day for nearly every day, because uncertainty in our lives really is inevitable, right? Generally speaking, all of us will have to face uncertain situations on a daily basis. But because this uncertainty is construed as very threatening for individuals with generalized anxiety, it also feels very exhausting and draining and takes up a lot of cognitive space and a lot of energy. Lastly, we have cognitive avoidance. And that cognitive avoidance is basically just the avoidance of threatening cognitive or emotional stimuli. So there are two types of cognitive avoidance in generalized anxiety. The first is implicit cognitive avoidance, which refers to the idea that worrying in and of itself prevents the activation of feared negative thoughts and mental images in one's mind. So in other words, worrying helps one avoid thinking about or imagining their fears, and that prevents the emotional processing of their fears. So again, this process negatively reinforces the idea that if I worry about something, I don't have to think about it. Therefore, it's adaptive and it's comfortable. We also have explicit cognitive avoidance, which refers to effortful and active strategies, such as deliberate thought suppression, the substitution of neutral or positive thoughts for worries, using distractions to interrupt that worrying cycle, or even actively avoiding situations or events that may trigger worries or anxiety. Now, over time, this avoidance gets reinforced until it pretty much becomes the only mechanism that successfully decreases anxiety, albeit temporarily, because although cognitive avoidance, whether implicit or explicit, does decrease anxiety in the short term, and it does so quite effectively, it increases it in the long term by reinforcing the idea that one needs to avoid all thoughts, all emotions, or all situations that cause anxiety. So now that we've described what generalized anxiety disorder is and what it looks and feels like in individuals, how do we go about treating it? There are three main approaches to the treatment of generalized anxiety. The first is pharmacotherapy, and it's a little bit more medical in nature since it includes the taking of psychoactive medication. The second is psychotherapy with cognitive behavioral therapy being the evidence-based treatment of choice for generalized anxiety. And compared with pharmacotherapy alone, psychotherapy does have lower attrition rates, meaning that less people tend to abandon or desist from treatment. So this does suggest that psychotherapy may be better tolerated than pharmacotherapy alone, but there's evidence that both are effective in the treatment of generalized anxiety. And lastly, we have a combination approach, which combines pharmacotherapy with psychotherapy. Studies do suggest that this may be the best approach for those with moderate to severe anxiety symptoms. So there is evidence that some brain chemicals, also called neurotransmitters, may be involved in anxiety, notably serotonin, norepinephrine, and GABA. So it makes sense that medication that helps treat anxiety would target those same chemicals in the brain. So the first line medications for generalized anxiety are antidepressants, and these act on the serotonin and norepinephrine receptors in the brain. If there are little to no results with the first line medications, then it is possible to add some second line medications. So these include the addition of perhaps another antidepressant or of benzodiazepines, which is a class of medications that act on GABA receptors. However, these should be used sparingly and only on an as-needed basis, like for example, in the treatment of panic attacks, because benzodiazepines do have a strong potential for abuse. Also note that you must always speak to a licensed medical professional before starting a regimen of psychoactive medication, and also to ensure proper follow-up. So as previously mentioned, cognitive behavioral therapy, or CBT, is the evidence-based treatment of choice for generalized anxiety disorder. So I will really focus on a CBT-based approach when discussing psychotherapy. The cognitive behavioral model for generalized anxiety kind of goes as follows. So when an individual faces uncertainty in their lives, this will influence how they feel, and typically they will feel anxiety. It will also influence how they think, and typically they will start worrying. And it will also influence how they behave. And typically we see that people will start engaging in safety behaviors like avoidance or like reassurance seeking. So in a CBT-based approach, the goal is to target those components of generalized anxiety that we've discussed, including excessive worrying, those positive beliefs about the function of worries, the intolerance of uncertainty, as well as avoidance and other safety behaviors. So this means that one, we need to identify the content and themes of worries and whether these stem from real, imagined, or hypothetical situations. Two, we need to reevaluate the usefulness of worrying in one's life and kind of challenge those positive beliefs. Three, we need to work on the development of skills that will help individuals tolerate and embrace uncertainty in their lives. Four, we need to challenge avoidance and safety behaviors through exposure. And lastly, we also need to work on relapse prevention. The ultimate long-term goal of CBT is for the client to essentially kind of become their own therapist, where they are capable of implementing the skills learned in therapy during their day-to-day lives. So the first step in treatment is the identification of worry themes and their content. So this helps the client build awareness of their worries and helps them become mindful of moments where they engage in worrying. So to do so, it's useful for clients to essentially just log their worries, right? This entails identifying the anxiety-provoking situation that triggered the worries, what worries are present, and to rate their accompanying anxiety on a scale of 0 to 10. 0, of course, being no anxiety present, 10 being the most anxiety someone can experience. It may also be useful for clients to categorize their worries as being tied to a current problem or to a hypothetical problem. And this is because oftentimes individuals with generalized anxiety tend to worry about hypothetical situations that may or may not actually arise. So classifying worries as either current or hypothetical may help bring some more nuanced perspective to the client. The second step to treatment involves the reevaluation of the function of worrying in one's life. There are 4 steps to this process. The first is identifying any positive beliefs about worry that one may hold. Once those positive beliefs are identified, we can then weigh evidence for and evidence against the belief. We then need to evaluate the advantages and disadvantages of worrying in someone's life. Once we have gathered all of that evidence, we're then able to weigh it, right? Do we see that the evidence supports my belief or does it contradict it? And the goal here is not to prove that clients are wrong in their beliefs about worry. It's really just to examine whether or not their beliefs about worry actually provide the benefits that they associate with it. So for example, let's say that an individual believes that worrying about the health of family members better prepares them to deal with negative emotions in the event that anything bad happens to those family members. When we inquire about evidence that supports this belief, often clients will speak of moments in the past where they felt better able to cope with family health problems due to their worrying. But when we ask them to describe evidence that may contradict those beliefs, clients often relate stories where either they worried about a health outcome happening, yet worrying did not necessarily prevent the experience of strong negative emotions, or they dealt with kind of like a spontaneous family health problem without engaging in worrying beforehand. So we see a paradox typically emerge. Although clients may feel as if they are better able to cope with negative health outcomes in loved ones if they engaged in worrying beforehand, they're also able to identify moments in their lives where this was not necessarily the case. The next step is to examine disadvantages and advantages associated with worrying. So if we keep the same example in mind, we may see that clients report, feeling guilt if they don't worry about the health of loved ones. They may also report that, worrying about their loved ones really helps communicate how much they care about them. But when it comes time to examine the disadvantages of their worrying, clients may also report, feeling very upset over spending an excessive amount of time worrying, or, difficulties with concentration because they're spending all of their time worrying, and also difficulties with their interpersonal relationships, especially if they're engaging in a lot of, reassurance-seeking behaviors. So although advantages and disadvantages are not mutually exclusive and actually do coexist alongside one another, it's not unusual to see the subjective disadvantages outweigh those kind of subjective advantages. Once we've gathered all of the available evidence, we're then able to weigh it and kind of like reach a verdict, if you will. And typically clients tend to reach two conclusions. The first is that their initial belief about, worrying is a little bit more nuanced and perhaps not completely accurate. And also that, the disadvantages associated with worrying typically outweigh those advantages. The third step of treatment revolves around slowly developing some tolerance to uncertainty. So the first thing we need to do is identify safety behaviors associated with uncertainty that clients engage in. So there are two main types of safety behaviors. We have escape strategies, which kind of refers to avoidance. And then we also have approach strategies, which includes things like, reassurance seeking, excessive information seeking, double checking, excessive list making, etc. Identifying these safety behaviors will really help clients build awareness about how their behaviors may actually contribute to their feelings of anxiety. We may also want to introduce tools and techniques to help soothe those feelings of anxiety and distress related to uncertainty. So these can include mindfulness techniques like progressive muscle relaxation or breathing exercises, as well as distress tolerance skills like grounding. The next step in treatment is exposure. But before engaging in exposure, it's really, really important to provide some psychoeducation. And that's because exposure requires individuals to directly focus on their thoughts and on their fears that they have tried a very long time to avoid. So initially, it can be really quite distressing, which not only is informed consent important throughout all of treatment, but it's especially critical here because clients need to know that they will experience distress and they need to consent to processing it in a safe space. So the first thing we need to explain is that attempts to avoid a feared situation is actually counterproductive. So let's say that someone is afraid of a dog and that every time they see a dog while they're out on a walk, they choose to cross the street in order to avoid the dog. What we see is that in the short term, sure, anxiety decreases, but in the long term, anxiety about dogs never actually disappears. So avoidance here really is not a useful strategy. We also want to explain that attempts at neutralizations are also counterproductive. Neutralization refers to kind of like deliberate attempts to reduce the experience of anxiety while in a fearful situation, similar to those approach strategies that we've discussed. So if we use our dog example again, someone may tell themselves, every time I'm going to see a dog, I'm just going to look away, right? In order to reduce my anxiety. And again, this works temporarily, but when the person will be faced with a dog again, their anxiety is going to come back. So the only solution that works in the long term to reduce anxiety about a feared situation is multiple rounds of exposure. Initially, individuals will experience a lot of anxiety, but with practice, clients learn that they're able to tolerate the feared situation. And over time, with each practice, anxiety will decrease and clients will begin to understand that the feared situation was perhaps not as threatening as once thought, and perhaps their abilities to deal with the feared situation are greater than once thought. Now, we've used the example of a fear of a dog for clarity, but in generalized anxiety, what we really want to expose clients to is uncertainty. We want clients to experience situations or activities that have uncertain outcomes so that they can challenge their belief that uncertainty is always something to be feared. And we typically do this through behavioral experimentation. So when we engage in safety behaviors or avoid uncertainty in our lives, we never actually give ourselves the opportunity to find out whether there is real reason to actually fear uncertainty. So in behavioral experimentation, what we do is that we put ourselves in situations that elicit that intolerance of uncertainty in order to, one, gather evidence to suggest that perhaps the situation is not as scary as one believes, and two, see that uncertainty is actually something that we're able to deal and cope with. So the premise of behavioral experimentation is as follows. First, we want to identify a situation that will elicit that intolerance to uncertainty. Next, we want clients to predict the outcome they believe will happen when engaging in that uncertain situation. Once clients have predicted an outcome, the next step is really just to actually experience the situation and the accompanying anxiety. So given that these situations are likely to cause some distress, we really want to make sure that clients are equipped with things like mindfulness, grounding, or distress tolerance techniques to really help soothe that discomfort in the moment. And once the uncertain situation has been lived, we want to help clients debrief it. Did the uncertain element in this situation lead to a negative outcome? And if it did, how bad was it? Were you able to cope with it? How did you cope with it? We really want clients to begin seeing that oftentimes the outcomes they feared happening does not happen. And that if they do happen, clients are able to cope with that situation. Now, here are a few things to keep in mind when conducting your own behavioral experiments. The first thing is to really start small, right? Behavioral experiments should be implemented in a graded fashion. So begin experimenting with kind of like realistic situations 1 to 2 times per week, and then increasing in frequency and in severity, if you will, when you feel ready. This will help develop a sense of agency and will also lead to greater success in the long run. Remember that you will feel anxious and to expect those feelings of anxiety. By facing uncertainty, there will be some distress involved. So we typically say that if anxiety is present during a behavioral experiment, it's because something good is happening and the client is doing the task well. And lastly, repetition is key. We really need successful repetition in order to change our beliefs about uncertainty being something that is threatening and to actually internalize that. The last step in treatment is relapse prevention. Progress and healing in psychotherapy is not linear. So it's not unusual for clients to have moments where they experience some downturns in their progress, and we refer to these as temporary lapses. So not only is it important to normalize these lapses and these dips in progress to avoid the clients, developing feelings of shame, It's also important to prepare clients for these moments so that they will be able to manage them should they occur. So the first step is really just to have clients understand and recognize that there are moments where they are likely to experience increased anxiety again, but that it doesn't necessarily mean that all progress has been lost or that, the client is not coping well. It's also important to differentiate between a lapse and a relapse. A lapse is a short-term, temporary increase in symptoms, whereas a relapse indicates a more lengthy return to how a client was functioning prior to treatment. The second step is to begin recognizing situations in which lapses may be more common. So typically this includes situations that may be high in negative moods or stressful life events. A good tip to help recognize these situations is to just pay attention to early warning signs where clients kind of resort back to those safety behaviors and those avoidance behaviors. And then the last step is really just to engage in self-care once those early warning signs have been identified. And this will obviously look different for everyone, but can include things like making a deliberate effort to reduce safety behaviors or avoidance behaviors, engaging in pleasant or relaxing activities, remembering and implementing techniques learned in therapy, and also just taking time for yourselves away from the situation or that's causing stress and anxiety. Most importantly, however, is how one speaks to themselves in their minds following a lapse. It's extremely important to be kind to yourself and to refrain from harsh self-judgment, from shame, and from thoughts of failure. In fact, how one responds to their lapses can actually influence the risk of future relapse. So studies actually suggest that individuals who respond harshly to these normal lapses and throughout treatment are at greater risk to have their lapse transform into a relapse. So be patient, be understanding, and be compassionate with yourselves. And remember to speak to yourselves with kindness and with respect. Here are a few resources that could be useful for at-home and self-help purposes. So the first is the Generalized Anxiety Disorder Workbook by Robichaud and Zuga. This is a really great and comprehensive resource, and I often recommend it to clients. There's also the Worry Cure by Robert Leahy, and that's a great read. And another great resource is anxietycanada.com. They offer a lot of free information and a lot of free resources about anxiety. And they actually have a free app called Mindshift where people can kind of track their worries, track their anxiety, and also practice some mindfulness techniques. If you stayed with me throughout this whole presentation, thank you for listening and thank you so much for your time. If you have any questions, please feel free to join us during our Facebook Live Q&A event on October 14th at 7:30 p.m. Here are my references for review and take care, everyone.